Hi, this is Jana Tarjeft. I'm a family nurse practitioner that focuses on functional medicine approach. And today I would like to discuss with you my passion, which is thyroid health. I have a lot of patients who come to me either with full labs done for thyroid health, or they just ask me to do the labs. What happens is a lot of times the full panel is done by a different provider, but the issues are not addressed. When your thyroid is not working, you may experience a number of symptoms, so I definitely don't look just at the labs. I also look at your symptoms, and I have a hypothyroid symptom questionnaire, because the symptoms could be as vague as just skin dryness and hair loss, which could be attributed to other mineral and nutrient deficiencies, or it could be thyroid not working properly. The hardest block for me actually was to diagnose some males who come to my practice with thyroid problems. Let's face it, men are not very good historians. They don't tell me exactly what symptoms are, and a lot of times the thyroid symptoms could be attributed to something else, not related to the thyroid itself. For example, if the man starts losing hair, I cannot tell if it's iron deficiency or thyroid deficiency. It could be just male pattern baldness that was experienced by his father previously at a young age. At the same time, vague weight gain that creeps up on the man who comes to my practice, that's also not possible to figure out without doing labs and doing all the symptoms. And of course, men don't want to share with me that they are constipated, or they may not be realizing it because, constipation comes in different forms and shapes. It's not one type of symptom that fits all. So my approach to thyroid health is to test, not guess, and do the full thyroid panel. Don't just limit with don't limit yourself just with free T3 and free T4. Do the full panel, which includes total T3, total T4. A lot of times, and reverse T3, but a lot of times I see okayish free T3, free T4, but very low total T4 or total T3, which tells me that there are not enough building blocks for the free T3 to be made, which is T3 is the main active hormone in your body. At the same time, symptoms tell a lot. So if a woman who has irregular periods, heavy bleeding, loss of hair, well, probably it could be iron deficiency, but it also could be thyroid deficiency, constipation, multiple or even one miscarriage, I definitely pay attention to the labs and to the symptoms, and a lot of times I make a suggestion to do the nutrient therapy to support thyroid hormone and thyroid hormone production, but in my opinion, a lot of women after 30 years old of age, they would benefit from a trial of thyroid hormone. If the symptoms are so vague and the labs are very, very suboptimal, it may happen that no nutrient therapy will help long term. So for example, if free T3 is 2.7, with optimal range would be 3.5, and I start someone on zinc, selenium, vitamin D, all other supplements that support thyroid health, the free T3 would only increase usually by 0.2, 0.3 points. So from 2.7 it goes to 3.0 in 3 months, but the person is as miserable as she was when she came to me for guidance. So yeah, like I said, thyroid comes in various shapes and forms. Do the thyroid panel, ask your doctor to do the thyroid panel, but also make sure your thyroid panel is interpreted correctly. Make sure that reverse T3 and free T3 ratio is calculated, because that's important. You may have thyroid resistance and your free T3 could be in 3.5 range, but still your reverse T3 is 30, which puts you into the resistant, thyroid resistance category, and you still may benefit from some type of thyroid hormone, or at least working on the things to decrease the reverse T3 in your body. Let me know if you have any questions. That's my first take on thyroid, but I have much more to say. Bye.